Diagnose mitochondrial disease. Mitochondrial diseases include a wide range of conditions that weaken a person's neuromuscular system, such as Alpers disease, Lee disease, or Luff disease. This is because the energy-producing parts of the patient's cells, called the mitochondria, are damaged. Recognizing a mitochondrial disease can be difficult because they have varying symptoms that can affect many different organs. Although most mitochondrial diseases show symptoms before the age of 20, they can also be present in adulthood. Recognizing symptoms of a mitochondrial disease. 1. Notice muscle weakens. Your muscles may feel tired and weak after minimal activity. You may struggle to pick up items or maintain your balance. Additionally, you may feel tired easily, especially after any kind of physical activity. 2. Watch for exercise intolerance. You may experience immediate fatigue when trying to exercise. The muscles, including the heart, become too weak for exercise. This means that you likely wouldn't have the stamina to be active for long. 3. Document movement disorders, such as difficulties moving or tremors. Weakened muscles make it hard to move around. This could mean that your legs aren't strong enough to carry you, or that you have trouble lifting your arms. Some people experience tremors or involuntary movements. 4. Notice issues with your eyesight, including blindness or droopy eyelids. You may also have difficulty moving your eyes, such as an inability to follow a moving object. If your vision suddenly changes or is in steady decline, talk to your doctor about the possible cause. 5. Get tested for hearing loss. Although not everyone with a mitochondrial disease will experience hearing loss, it does happen. The type of hearing loss most associated with mitochondrial disease is called neurosensory hearing loss. This means that the cause of your hearing loss is related to your inner ear, including your nerves. Hearing tests are simple, easy, and painless. Getting a medical diagnosis. 1. Visit your doctor. Your doctor will rule out other possible causes and, if necessary, refer you to a specialist for further testing. Mitochondrial diseases are very hard to diagnose because they share symptoms with other illnesses. Fortunately, there are diagnostic tests that your doctors can use to determine if you have one. 2. Expect your doctor to eliminate metabolic issues. These conditions can mimic the symptoms of mitochondrial disease, so they need to be eliminated as a potential cause for your symptoms. To eliminate these conditions, the doctor will do a blood test to check your triglycerides, cholesterol, and blood sugar. They'll also measure your body weight and blood pressure. 3. Undergo genetic testing. Genetic testing can show if you have an issue with your mitochondrial DNA or nuclear DNA, both of which can cause a mitochondrial disease. A specialist can examine the DNA to determine if these conditions are a possibility. Keep in mind that a negative test result does not mean that you don't have a mitochondrial disease, so more testing could be necessary. 4. Get tested for lactate acidosis. About half of patients with a mitochondrial disease will have extra lactate in their bodies. This can cause lactic acidosis. Although not all patients will experience this, it can help the doctor make a diagnosis if you do.